This is the first lecture about infant feeding. The objective of this lecture, we will have introduction, selected beneficial properties of human milk compared to infant formula, protective effects suggested to be in human milk, what is colostrum, advantages, contraindications, and problems associated with breastfeeding, problems affect successful breastfeeding, the factors that conduct to successful breastfeeding. The dramatic growth of infants during the first year of life and continued growth, even though at lower rates, from 1 year of age through adolescence impose a unique nutritional needs because the rapid rate of growth are accompanied by marked developmental changes in organ function and composition. Failure to provide sufficient nutrients during this time is likely to have adverse effect on development as well as growth. The American Academy of Pediatrics and World Health Organization have declared breastfeeding and the administration of human milk to be the normative practice for infant feeding and nutrition. Breastfeeding should be continued with the introduction of complementary food for 1 year or longer as mutually desired by mother and infant. Feedings should be initiated soon after birth unless medical conditions preclude them. New mothers should be instructed about infant hunger cues or correct nipple latch positioning of the infant on the breast and feeding. Ideally, immediately after birth, the baby will be placed neck on his mother's neck body. They can be both covered if necessary and left like this until he is ready to breastfeed. An estimated 78 million babies, or 3 in 5, are not breastfed within the first hour of life, putting them at higher risk of death and disease and making them less likely to continue breastfeeding. 41% of newborns that die in the first month of life could be saved if breastfed in the first hour of life. Selected beneficial properties of human milk compared to infant formula. First of all, antibacterial factors, which include secretory IgA, it has specific antigen, targeted anti-infective action. B. Lactoferrin, immunomodulation, iron chelation, antimicrobial action, anti-adhesive, trophic for intestinal growth. C. Casein, it has anti-adhesive and bacterial flora. D. Oligosaccharides, prevention of bacterial attachment. E. Cytokines, anti-inflammatory epithelial barrier function. Growth factors, which include epidermal growth factors, luminal surveillance, rapid repair of intestine. B. Transforming growth factor, promote epithelial cell growth, suppresses lymphocyte function. C. Nerve growth factor, promote neural growth. Enzymes, which include platelet activating factor acetyl hydrolase, which block action of platelet activating factor. B. Glutathione peroxidase, which prevent lipid oxidation. C. Nucleotide enhance antibody response and bacterial flora. Condition for which human milk has been suggested to possibly have a problem, a protective effect. We have many conditions: acute disorder, diarrhea, otitis media, urinary tract infection, necrotizing enterocolitis, septicemia, infant botulism, insulin-dependent diabetes mellitus, celiac disease, Crohn's disease, childhood cancer, lymphoma, leukemia, and even increasing infant mortality. The American Association of Pediatrics recommends exclusive breastfeeding for a minimum of 4 months and preferably for 6 months. It is preferable to empty the first breast before offering the second in order to allow complete emptying and therefore better milk production. Colostrum, the earliest milk to be secreted, the daily volume is only 10 to 40 ml per day, and it is sufficient to the newborn baby. It is lemon color, thick, sticky, alkaline with high specific gravity, about 1.040 to 1.060. It is very rich in proteins, vitamin A, and sodium chloride, less amount of fat, carbohydrate as lactase, and potassium. It contains high concentration of leukocyte, which can destroy disease-causing bacteria and viruses. Can destroy disease-causing bacteria and viruses. It has unique immunological factors such as IgA, IgG, IgM, lysosomes, and lactoferrin. It has mild laxative effect, encouraging the passing of the baby's first stool, which is called conium. Problems associated with breastfeeding. First, nipple pain. Nipple pain is one of the most common complaints of breastfeeding mothers in the immediate postpartum period. Poor infant positioning and improper latch are the most common reasons. If the problem persists and the infant refuses to feed, consideration need to be given to nipple candidiasis. Second, engorgement. The breasts are firm, overfilled, and painful. The cause may be incomplete removal of milk, frequent breastfeeding, or in some cases, with a combination of hot compresses and manual milk expression before breastfeeding. Third, mastitis. 2 to 3% of lactating women, it will occur with them. Usually it unilateral, and the clinical feature characterized by localized warmth, tenderness, edema, and erythema after the second post-delivery week. Microorganism, usually Staph aureus, E. coli, group A streptococci, Haemophilus influenzae, Klebsiella pneumonia, and bacteroid species. Diagnosis is confirmed by physical examination, oral antibiotics and analgesics, while promoting breastfeeding or emptying of the affected breast. Fourth, milk leakage. It is a common event. Milk is involuntarily lost from the breast either in response to breastfeeding on the opposite side or as a reflex in response to other stimuli such as an infant cry. Milk leakage usually resolves spontaneously as lactation proceeds. Fifth, inadequate milk intake may be due to insufficient milk production or failure of established breastfeeding, but also fetal cause that prevent proper breast stimulation. Breastfed unit must feed a minimum of 8 times per day. Six, jaundice. Breastfeeding jaundice is a common reason for hospital readmission of healthy breastfed infants. And also we have breast milk jaundice causes persistently high serum indirect bilirubin in a thriving healthy baby. Exclusive breastfeeding means nothing added to the breast milk. Almost exclusive breastfeeding, it means addition of water. Partial breastfeeding, only 20 to 80% of breastfeeding. Talking breastfeeding, less than 20% of breastfeeding. Lactating women supplies 800 to 850 ml per day of milk, which is equal to energy loss of 600 kilocalories. The diet of lactating women should be rich in minerals, protein, and vitamins. Advantages of breastfeeding. Breast milk is the natural food for full-term infant and is the appropriate milk for the first year of life. Easier, safer, cheaper, and readily available. It is fresh and free of contaminating bacteria. Breastfeeding is associated with fewer feeding difficulties incident to allergy and or intolerance to bovine milk. These include diarrhea, intestinal bleeding, occult maleness, spitting up, colic, and atopic eczema. Breastfed infants also appear to have a lower frequency of certain allergic and chronic diseases in later life than formula-fed infants. Emotionally satisfactory for the mother and it gives feeling of security to the baby. Antimicrobial property as Antibodies, immunoglobulin against bacteria and viruses, and relatively high concentration of secretory IgA, phagocytic cells, granulocyte macrophages, lymphocyte 90% of which are T lymphocytes, enzymes, lysosome and lactoperoxidase, proteins, lactoferrin, the iron binding Y protein which inhibit the growth of E. coli, E, resistant factor resistant factors against staphylococci and bile salt stimulated lipase called Giardia lamblia and Enterobiocystic. The lower pH of the stool of breastfed infant is thought to contribute to the favorable intestinal flora of infants fed human milk compared with formula, more bifidobacteria and lactobacilli, fewer E. coli. G complements I interferon producing cells. Contraindication of breastfeeding, most of them are temporary. In mother, severe systemic disease as acute heart failure, thyrotoxicosis, neoplasia,